Okay, this is Chapter 3 mini lecture. Chapter 3 is all about assessment and diagnosis. I'm going to talk about assessment because I think that's a big component and sometimes it's hard to understand the difference between them. So what I have up here are 8 different types of assessment that we use in psychology. What I really want you to focus on and think about is the purpose of these assessments. When would we use them? When wouldn't we use them? Because we never give all of these assessments whenever we're working with an individual. When we're working with somebody, we usually are trying to answer one of 4 different questions. What is the diagnosis? That's almost always our first question for assessment. But also maybe what's prognosis, what's the etiology, and what's the treatment. You've seen those 4 things come up before. That's how we're sort of structuring the class. So the first one is interviews. These could be structured interviews or unstructured interviews. Be sure to look at the difference between them. We use interviews every single time we assess. I'll say it again, the only thing that we always do is an interview. Without a clinical interview, you have no idea what the rest of the stuff is telling you. So we use the clinical interviews for all 4 of those things, to diagnose, to figure out the prognosis, to determine etiology, and to determine treatment. So an interview is always necessary. The second one, a personality test. This is kind of a big group of different tests. We could categorize them based on objective tests, such as the MMPI and the MCMI, or subjective tests like the Rorschach test, which is an Inklock test, or the TAT, thematic apperception test. With objective tests, we're primarily looking at things like diagnosis, but with subjective tests, we usually use them in the course of treatment. Subjective tests do not do very good with diagnosis, but sometimes they can help us lead us down certain paths when we're talking about treatment. General psychological functioning, so usually these are scales. So from 0 to 100, where do you fall? That's not very good for diagnosis, but it is great for prognosis, and it is great for treatment. So we usually use them to determine how severe a person is. That's why it's called general psychological functioning, and also what level of treatment. Do they need weekly therapy sessions? Do they need to be inpatient? Do they need to be hospitalized? That sort of thing. Neuropsychological tests are very specific. They're looking at diagnosing specific cognitive impairments. So we usually use them if there's something that's happened to the brain, like a stroke, or if we think there's Alzheimer's or some other kind of dementia going on, or if they've had a traumatic brain injury, so they've fallen and hit their head or something like that. So we're looking at sort of diagnosing specific cognitive impairments, but we wouldn't use it for somebody with depression. That wouldn't help us very much. Neuropsychological looks at attention and memory and things like that. Intelligence tests, again, very specific for certain diagnosis. So we might use it for diagnosing learning disabilities. We could use it to rule out issues involving ADHD. We could use it in terms of issues with IDD, intellectual developmental disability, but in a normal assessment we wouldn't use it because unless somebody's intelligence is taken into account or we think there's something going on with that, then it wouldn't tell us anything. It wouldn't tell us that somebody's depressed. Now a specific symptom test does help us with diagnosis. So there's lots of these out there. There's some that are specific to certain diagnoses like the Beck Depression Inventory. You can use that to see where they fall in terms of their criteria for depression, and it can be used really easily to diagnose somebody. There's also tests out there that are a series of questions, and it will lead you to a particular diagnosis. So it's not specific to depression, but it could tell you lots of different diagnoses there. So that's really great for diagnosing individuals. Behavioral assessment, we often use behavioral assessment when we're trying to look at etiology. So behavioral assessment is all about somebody monitoring their behaviors, or we're actually watching somebody's behavior. We usually do that when it comes to children because it's kind of hard to watch adults' behavior. So we might watch children in a lab setting, and we might say, oh, they had an anger outburst right when this particular thing happened. So we're looking at the etiology, the cause potentially of some of those symptoms. Psychophysiological, things like getting an EEG reading or taking blood pressure, we use that mostly in research, so we don't use it a lot in the actual clinical field. However, we do sometimes use it when we're talking about treatment. So there's a particular treatment called biofeedback that works really well for anxiety disorders, and it is a psychophysiological assessment. So be sure to check that out. All right, so once again, chapter 3 is all about assessment and diagnosis. Think about, there's my 5 minutes, think about how each of these components can be used and not used, but also in terms of diagnosis, think about the history of the DSM and how the DSM is useful, what's the advantage of having the DSM and certain diagnoses, but also what's the disadvantages. What are the problems with our current diagnostic system and just diagnosing in general. All right, that is your chapter 3 mini lecture.